Now watch this video of Odumeje and his church members.
The first doctor said he's suspecting glaucoma.
Okay, the first doctor said he's suspecting glaucoma.
Yes, sir.
The second one said
The
what?
second doctor said it's papidemia.
Papidemia Hotel.
Papidemia. Papidemia.
Okay, pandemia.
Papidemia.
Patricidemia.
So glaucoma is an eye condition which causes damage to the optic nerve. So it's the optic nerve that actually carries the information or whatever we are seeing to the brain, so that the brain can be able to interpret it for us, tell us that this is what we are saying. So, but in glaucoma, the optic nerve is damaged because there is like increased pressure in the eyes, just like what happens when there is increased blood pressure. So, but in this case now, there is increased pressure inside the eyes, and then eventually damages this nerve. So, which is why people with glaucoma are gradually losing their sight. So people with glaucoma is not something that you actually notice immediately, except in the acute ones, which is very rare. But in chronic open angle glaucoma, what happens is that the person gradually lose their sight over time. They start by having peripheral, losing their peripheral vision, and then it just graduates, it just moves on like that. So sometimes people don't even know that they're having this condition until years and years and years. Now, which people are at risk of having glaucoma? So, people who are over 60 years old, they have more risk of having this condition. Another set of people is that people with family history. Sometimes you can't explain it, but you just know that at some point in this family or in their life, they always have loss of sight due to glaucoma. So, it kind of repeats. There is really much you can do about it in some cases. Another thing is high blood pressure. Remember, I said increase intraocular pressure is what causes this optic nerve damage. So for people who are hypertensive, they are at more risk of having glaucoma. So if you have high blood pressure, you have more risk of actually having glaucoma. And then also people who are diabetic, diagnose glaucoma, the doctor would normally do certain eye examination and tests for you to be able to say if you have glaucoma, or it could be any other eye condition that is making you lose your sight. Now, there is no permanent cure for glaucoma, which makes it frustrating for people, which is like why somebody like the person we watched in that video, she already went through the process of actually getting a diagnosis from her doctor, but she's still like coming back to see if there's an alternative. That is because there's no permanent cure, but the doctor would normally maybe give an eye drop, and sometimes there's even a surgery that can help to reduce the pressure that is in the eye to preserve the optic nerve. So those are like the treatment, but there's no permanent treatment, which kind of makes it very frustrating for people. They want like something that can go immediately. Now, for people who are at high risk, which is those risk factors that I mentioned, if you have diabetes, if you have hypertension, or if you have a family history, and you want to know what can you do to actually help preserve your vision, what you can do is to have regular eye examination. So if the doctor is able to detect it on time, they can start treatment on time for you, so that you're able to preserve the nerves in your eye and also preserve your vision. Thank you guys for watching.